Hi. So 1 in 4 women either have urine leakage when they cough or they sneeze, or they feel that they cannot control their urine, or whenever they lift something heavy or they are exerting themselves, they feel that the vagina is slightly coming down. So when they have one of these symptoms, the most common explanation is that they have a loss in the pelvic floor muscle tone. So why is there a loss in the pelvic floor muscle tone? It can be due to various reasons. The most common reasons being multiple normal deliveries, or if they have an assisted vaginal delivery using a vacuum cup or a forceps, which would have caused injuries on the muscle fibers, or due to sexual abuse or mutilation, genital mutilation, which would have led to a poor muscle tone. So how do women improve their muscle tone, or how do they preserve their muscle tone? There is one important exercise which is called the Kegel's exercise that every woman should follow every other day so as to preserve their muscle tone. So when we talk about pelvic floor muscle, it's important to know about the anatomy. So the pelvis is a bony structure which is like most commonly called your hip bones, and between your hip bones there is a hammock shaped muscles which are supporting the urinary bladder, the uterus and the rectum. So these particular muscle fibers are very important, and their tensile strength and their tone is very important to hold all the structures in place. And whenever there is a loss of tone, or there's an injury with the muscle fibers, or the tensile strength is low, what happens is each of these organs will go in for some symptoms. Like the urinary bladder will cause a little bit of urine leakage, which is called stress urinary incontinence, or there can be general urinary incontinence as well, or the vagina can go in for a prolapse where the uterus is either coming down through the perforations, or there can be an anal incontinence as well. So in order to prevent all of it, it is important to preserve your muscle tone. Muscle tone can be reduced due to various reasons, like previously what I explained the causes of it, or it can also be very well due to aging, because aging will also reduce the blood supply, the hormonal supply for those muscle fibers, and they tend to sag like how a hammock does, and then which will lead to all these symptoms explained before. So what is this exercise? What is Kegel's exercise, and how do we do it correctly? The key to doing Kegel's exercise correctly is to identify the right muscles and then work them correctly. So to identify the right muscles, it's important to know which symptoms you're having and do the Kegel's exercise accordingly. So if you're having urinary incontinence, then it's important to know the muscles which are around the urethra. Whenever you're passing urine and you contract that particular muscle and stop the stream of urine, that is the muscle that we are targeting at this point. So it is important to know and identify that. If you're having a uterine prolapse, or you feel that there is like a weakness in that particular area, whenever you tighten the vaginal muscles and then sort of pull it up, like how you would pull the vagina with a little bit of a string, you pull it up so as to you feel a discomfort in your anal area as well as your lower abdominal. That is how you identify that particular muscle. And if you're trying to work the anal muscle, then it's important to contract your anal muscle to an extent where you feel that you're trapping the gas which is trying to escape, or you're holding back the motion that will come through it. So it's important to hold those muscles in positions for a set amount of time. So while you're doing Kegel's exercise, it is important to start slow. It can be done in any position. You can stand and do the Kegel's exercise, you can sit and do the Kegel's exercise, you can lie down and do the Kegel's exercise in the right, left, or facing upwards also. You can do it in any position that you want. So let's talk about the sitting position. So when you're sitting and doing the Kegel's exercise, once you identify which muscles you want to work at that moment, it's important to hold the muscles in a contracted position for about 3 seconds and do at least 10 repetitions in the morning, then 10 repetitions in the afternoon, and 10 repetitions in the night, which means hold the muscle in a contracted state for 3 seconds, then relax, give a 10-second break, and then again contract the muscle, keep it in that position for 3 seconds, then relax, then again contract the muscle. Do this as 10 repetitions in the morning, 10 in the afternoon, and 10 in the night. Once you're done with that, for about 1 week or 2 weeks, start increasing the time you've taken for contracting that muscle to 5 seconds. Instead of 3 seconds, hold the muscles in position for about 5 seconds. Keep it so for 5 seconds and relax it. Give a 10-second break and then go to the next repetition. And do 10 repetitions in the morning, afternoon and night. And once a couple of months are over, you can start contracting the muscles and keeping it in position for about 10 seconds and give a 10-second break and then again contract it for 10 seconds. Do the repetition 10 times in the morning, 10 times in the afternoon and 10 times in the night. Once you come to that level, you can start practicing it every day, holding it for about 10 seconds, doing 10 reps in the morning, afternoon and evening. So this will improve the muscle tone in the pelvic floor, and it will prevent you from having stress urinary incontinence or a vaginal prolapse or an anal incontinence. So once you start practicing this, it will automatically improve your muscle tone and it will prevent you from having any of the said conditions. So in case if you already had a vaginal prolapse or you already having a stress urinary incontinence or an anal incontinence, Kegel's exercise will only prevent it from increasing the grade. Like it will prevent you from having a higher grade, but it will not correct the existing condition. If you're already having a severe stress urinary incontinence or a complete UV prolapse, uterovaginal prolapse, or if you're having anal incontinence, it will not correct the underlying condition. It will only prevent the increase in stage, like it will prevent it from going from one grade to the other, but it will not correct the existing condition. And which age group of women should start doing these exercises? Usually women of all age groups can do Kegel's exercise starting from 20 years to 50 years, because any sort of pelvic injuries or pelvic surgeries or just aging or genetic factors can play a role in decreasing the muscle tone. So it's important for us to preserve our muscle tone, and hence any age, women of all age groups can start doing pelvic floor exercises every single day. And how do you know whether you're doing your pelvic floor exercises correctly? Is by knowing that you're not working any other muscles. So when you're doing pelvic floor exercises, none of your other muscles should be in action. That is, your back muscles should not be contracting and relaxing, your abdominal muscles should not be contracting and relaxing, neither should your muscles in the buttock be contracting or relaxing. So anyone watching you should not know that you're doing pelvic floor muscle exercises. That's when you're doing the exercises right. When you're working other muscles along with it, it means there's some sort of a mistake that you're doing in the way you're doing the pelvic floor exercises. So it's important not to clench or not to contract any other muscles or utilize any other muscles when you're doing pelvic floor exercises. So when you're doing pelvic floor exercises, you will not have back pain, you will not have lower abdominal pain, or you will not have any other discomfort or pain. If you're having any discomfort or pain, maybe the posture is not right, or the method in which you're doing might not be right. So it's better to have a consult and then get it sorted. People also think doing plank and doing abdominal exercises are also related to pelvic floor exercises, which are very, very wrong. It is not true. As I already told you, when you're doing pelvic floor exercises, no one will even know you're doing pelvic floor exercises. It will not work any other muscle. So you cannot combine it with any other routine exercises and do it along with it. You have to do it in any position, but at a position of rest, and then start doing your exercises. So the most important take home message is, make sure that you start doing pelvic floor exercises no matter what age group you belong to. It's important that you improve your muscle tone and preserve your muscle tone so as to not have any symptoms or any conditions later on in life.